In this video, Jackie, Flynn, and I are talking with Dr. Linda Homeyer and Marshall Lyles about their new book, Advanced Sandtray Therapy, Digging Deeper into Clinical Practice. Dr. Homeyer is a Distinguished Professor Emerita of the Professional Counseling Program at Texas State University. Dr. Homeyer served several years on the Texas Association for Play Therapy Board of Directors and served 2 terms as president of the Association for Play Therapy, or APT, Board of Directors. She received APT's Lifetime Achievement Award in October of 2013 and Director Emerita in 2016. Marshall Lyles has 20 years of practice in family and play therapy. He regularly teaches on trauma, expressive therapies, and attachment-informed family work around the globe. In his interview that was recorded live, Marshall and Linda will talk about their new book and everything from the neuroscience of Sandtray to the integration of Sandtray and EMDR. Here is the interview. Welcome you. We are excited to have Dr. Linda Homeyer and Marshall Lyles joining us in a live interview. And Jackie, Flynn, and I invited Marshall and Linda to talk about their book, Advanced Sandtray Therapy, Digging Deeper into Clinical Practice. And yeah, that's the book. Jackie has it right there. And before we start talking about the content of the book, I was wondering, Linda and Marshall, if you can share a little bit about the background of how you came up with the idea to write the book, what inspired you, and what got you to collaborate on writing the book.
You go ahead and take that one, Linda. You wrote it beautifully, so you can jump in there.
Well, first of all, Marshall and I have been collaborating for many, many years, both teaching together, presenting at professional conferences in Texas and the United States, and then various places around the world, doing training in play therapy and Sandtray therapy, working with parents, lots of different kinds of therapy work. But our love is really Sandtray therapy. And we had most recently, before COVID, been going to Istanbul together twice a year for a while, teaching. First week, we would teach some on basic Sandtray, including other play therapy topics. And then the second time we would go, we would teach on advanced Sandtray therapy. And we had done this the second year, I think, Marshall. And as we always did at the end of a long teaching day, because they go like 8 hours of training days, we were sitting down, reminiscing and looking back over the day and enjoying a beverage. And Marshall looked at me and said, this is a great outline for a book. And so I said, you're right. Let's talk about doing that sometime. And eventually we came back here to the States. I'm about an hour drive from where Marshall is in Austin. So we got together and started collaborating on actually putting together a proposal, the routine, sending it to the publisher, and they were excited about it. And many months later and many words later, we we're delighted with the book that came out.
Yeah, and we are delighted too. Marshall, what did it look like from on your end?
It was really exciting to explore as a possibility because Linda has been down this road before and really understands the publishing world. And I love writing. Writing was my first love, and it was what I studied in undergrad, and thought it's what my career was going to be. And then therapy surprised me when that popped onto the radar. And so getting to have someone as gracious as Linda, who was really familiar with the process, and she was able to take the lead on understanding the background parts that aren't actually writing that you have to do in order to get to write. That allowed me to have some mentorship into that world. And plus we enjoy each other's company quite a lot. And so like even when we would get together to, brainstorm or to write or to edit, it's just always some shared delight. And the subject matter for Linda and I both have such a conviction about the potential and the responsibility that comes when you do such a right hemisphere saturated approach like Sandtray Therapy, that not only would it like stoke some playfulness, but it would allow us to get passionate about our belief and articulate some things that maybe hadn't been able to be fully said in such a way until we focused on the book. So it was really lovely and confirming experience about why we do what we do.
Yeah, it's great that you mentioned the role of the right brain, which is something you write quite a bit about in chapter 5 of the book. You talk about the importance of the right hemisphere of the brain in the process of healing from trauma. So I'm wondering if you can talk a little bit about that, and how do you engage the right brain with Sandtray Therapy?
So, I mean, my personal bias is that even the most left brain therapies, when they start working, it's because we've sunken into a right brain rhythm.
Yes.
And so whether or not we want to be intentional, the right brain is going to be an agent of healing for the work, because it's where the deepest and earliest patterns of not just woundedness, but how we learned to make meaning about woundedness are stored. And so anytime you can find your way to an approach that is sensory enough and movement oriented enough and imagery forward enough, that you really allow that part of the brain to safely awaken and find its way to expression of things that maybe didn't have neurological access to words before that moment. It's profound. Those parts of the brain can communicate. They just don't always have verbal communication as an option. And the sadness that ends up being there is there's a loneliness and alienation, because if I can't have any way of helping you see that part of me, that part never gets understood, and it never gets all the compassion and attention it needs to integrate into the rest of what's presently true. So Sandtray is a really beautiful, slow, mostly bottom up, right to left sort of rhythm that we get to engage in with people who might have started off otherwise fragile.
And we know from play therapy that it doesn't take a lot to engage for most people. When we know with young children, my specialty in play therapy was 3-year-olds. And so, they come in and they are right brain. They're to shift them to left brain is what's more difficult with young children in play therapy. So if given the right environment, the engagement is a very natural process and can be easily done by all age clients. So the whole idea of imagery, emotion, even the fragmented memory that's stored in the right brain just kind of pours itself out unintentionally sometimes, whether it's in a play therapy room or in a Sandtray.
Yeah, I am curious. You mentioned play therapy and working with very young children, and I'm curious how the world of Sandtray developed into working with adults.
Well, I'm kind of the history buff on that. So
Yeah,
Margaret
right.
Lone,
I'm asking the right person.
yeah, right. So Margaret Lowenfeld, who developed, and she's well known for developing the world technique and what she called Sandtray Therapy. But it was within the broader concept of play therapy. So if you were to Google online and look for Margaret Lowenfeld's first playroom, you'll find a picture. And there's a sand tray, and there's art materials, and there's all kinds of other activity based work that can be done in this very large room. And so from the very beginning, a sand tray was merely one component of a play therapy space. So it really started with trying to help children communicate, because they did have that lagging ability to talk. But right away, Margaret Lowenfeld started using it with adults. Other people that studied with Margaret and went back to their own countries and did work immediately began using it with adults. And for many clinicians now, they only use it with adults.
Mm-hmm.
So it's like an expressive arts tool that can be used by many different kinds of clients for many different reasons.
Yeah.
Did that answer your question?
Yes, absolutely. And I can keep asking questions. I'm wondering, Jackie, if you would jump in.
Yeah, Rotem, what I did just now in the chat, I Googled Margaret Lowenfeld and the first play, Sandtray, and in the chat right now is an image of when that world technique, one of the most common directives, especially in the beginning of the therapy experience, show me your world. I have to say, while you visually, when you go into a Sandtray therapy space and you see all the miniatures, you may think automatically kids, but with adults, it is incredible as well. Yesterday, I had 5 sessions. Every single session or incorporated Sandtray. Every session was very different. We could not have gotten to the depths that we did without this work, because the miniatures are very symbolic of even parts of themselves that they're not aware of.
Yes.
It's fascinating.
Yes. And sometimes I'll have clients and I'll just ask them, just pick a figure that illustrates that for me, because they're adults, they're doing talk therapy. They're not sure they want to do a sand tray, right? Because it's for children. And they get astounded by the meaning as they continue to talk about what that symbol of that figure means to them. And then they're sold and they're easy to engage into the tray.
I'm wondering, Linda, as you were talking, I was thinking about, when I'm doing EMDR preparation, for example, and I get, engineers or Microsoft employees, or you know what I mean, like people who are all in their left brain. How do you work with people who are very left brain oriented?
Marshall, maybe because that's verging into EMDR, you'd pick that one up.
Sure. Yeah. First of all, have no fear. You gotta go. You gotta pull in all the energy. And the number one thing that I try to remember is people are attracted to confidence in something. If I believe in an approach, if I believe in a material, and I present the option straightforwardly and with conviction, but without pressure, that's attractive. People want to be a part of it. So it's not something that you can, especially with a left shifted adult, tentatively suggest. You just drop the option. Here's the thing. I think this could help. Let's give it a go. Yeah. And you get the proper buy-in, consent, but it becomes, especially with left shifted people, knowing the right amount of information to give without overselling it, without making it sound like you're asking them to, buy your timeshare. Like, you really got to find that in-between space. And depending on the type of left shifted they may be, they may need a little of the neuroscience of why, a few sentences about, here's why I think that would work with this. If I'm also trying to integrate EMDR into it and into a phase 2 thing, I might wait and see if they struggle with imagery because a lot of left shifted people, that's what they'll say when you try safe, calm place. Well, I can't think in images. Oh, great. I've got tools here for people who struggle with that. So let's choose some objects and let's build one. And so it's just transitioning with confidence. It'd be my bottom line.
I definitely agree. And I think that, we run into the same challenges when we work with EMDR clients who are in at least in a preparation phase. And I agree. Education about the neuroscience of imagination, the activity in the brain, and the parts of the brain that are being activated. So while we're on the topic, I'm wondering if you can talk a little bit about the neuroscience behind Sandtray Therapy.
I missed the last part of that question. I don't know if it was me that froze or not.
Oh, I was wondering if you can talk about the neuroscience background of Sandtray Therapy. And I think one of the words that were used in the book was neurodivergence.
Yeah, Linda, you want to jump in there with that?
Well, neurodivergence, in many ways, that is our more current and appropriate term when talking about the broad population of neurodiversity, and then neurodivergent, instead of using more diagnostic terms like autism or even gifted children, gifted adults. It's more of a general term for that, which allows us to just simply clue into more of the neuroscience that so many clinicians are aware of now. 20 years ago, not so much, right? It was always a big topic at conferences because people weren't up to speed yet on left brain light, right brain. Window of tolerance wasn't even talked about 20 years ago, those kinds of things. So Marshall, add to that.
Yeah, because I think we're learning more and more about therapies that the healing is best if it first comes up through the body, that if we can really get in what's often called a bottom-up approach, that brainstem and diencephalon, lower regions of the brain, to relax and to give permission to then move up through some of those typical stress responses that a lot of, especially trauma clients, have been conditioned to believe that immediately upon receiving stimuli, something dangerous is going to happen, and that amygdala just kicks them back down into action or shutdown. And that loop is so strong that they don't really even have the neurological option for bypassing that and reaching for all of the other beautiful parts of them that can make current meaning and can see something different and can remember their strengths. So the Sandtray, part of the believed neuroscience that's also true for many expressive arts, is that it gently works up through that space so that they don't have to neuroceive only danger, that they can come to know themselves in a gradual, self-determined pace with all the benefit of sensation and movement that they need in order to then explore without the hesitation and freedom. Because, EMDR would tell us most people who have trauma, they know that if they go exploring their inner world, they're going to find pain. Mm-hmm. So they turn off curiosity as part of the self-protection, but curiosity in that relational nature is what they really deserve to get to heal and to find what else is true. So it's one thing, it's one way that we can really give the nervous system what it needs in order to accomplish that task.
Yeah, thank you.
Gosh, that's beautiful.
Yeah.
Yeah. Oh, I love the way that you described that, Marshall. Just thinking about how, every day working with clients that have this self-protection mechanism, they may be either trying not to go as deep because they know the pain underneath there, whether it's through cognitive memories or early developmental stuff. And the fact that this can bypass and get to where it needs to in a very gentle way is just fascinating. But just to hear it through those neuroscience terms is like, it puts some validity to what the healing that we see in our office.
And I think it's so interesting too to know that the sand can both soothe and activate. So you've got a material that's right in front of the client that can do either, depending on the need of the client at the moment. So it's an exciting kind of modality and materials to work with.
I was going to say that in a little different way too, that right where you are, that one of the theories behind EMDR, why it might work, is that it allows the orienting response to be used in a new and novel way, because our clients are used to their orienting response just happening when they're triggered, and they're constantly looking for triggers. But with those eye movements or whatever type of stimulation we're using, when that theory is that it allows them to have a novel thing to have to notice and to orient toward while working something in the background. I think Sandtray is really similar, is that they're giving it some novelty that's being introduced and a different way of orienting to your inner world that allows enough engagement and enough taxation of that working memory that we can really then afford to risk integration. Because it takes a lot of courage to say, I'm going to open up to maybe let these things be true at the same time as other things. So anything we can give that supports people having the exact amount of up or down regulation they need to help facilitate that sort of new meaning making is worthy.
Yeah, that's fascinating, Marshall. And I would love to hear more about the integration of Sandtray and EMDR. But before then, I want to go back to what Linda said about the sand can be activating. And in EMDR, we're always thinking in terms of the window of tolerance. Where is my client right now? I'm constantly paying attention to, are they overactivated? Are they dissociating? What does it look like in Sandtray therapy, and how often do you see people activated? I mean, in EMDR, we see a lot of times people activated because this is what we do. We're activating these memories. So I'm wondering what the experience is like with the sand.
Well, I think in non-EMDR therapy, which I would be more familiar with and use, I sometimes even teach the window of tolerance to the client in the Sandtray, and have them put above what are figures that represent when they're hyper, and then below what are some of the figures that represent how they feel when they're hypo, and then in the center, figures that represent how they're managing life. And then we talk about working the edges, that we need to be sure that we don't go too far high or too far low. And how do they bridge? What kinds of activities do they already experience bridging into that? And that gives us a common terminology to use then when we go on and work with some of their own presenting issues in the Sandtray. And then that common language of I'm noticing things that your breathing is increased, so I'm noticing you're tuning out. I notice you're tuning out, so let's step back and take a moment. So there's just so many different ways to use those kind of similar kind of concepts, but with non-EMDR focused work.
Yeah, so you're definitely using the window of tolerance as
Yeah, and I may teach it, I may not, maybe that's because I tend to do more of that. I'm an Adlerian therapist, and so there's that educational, psychoeducational component that I think is important for clients to know. So that's frequently a part of my work.
Yeah.
I love that. That's like really maximizing the use of the sand tray, because that tray becomes the place where it all happens. It's pretty neat. Even like teaching like the window of tolerance and drawing the lines in the sand and talking about the
Right.
I never quite thought about it like that before.
Yeah, and using bridges, actual little bridges, miniatures about what do they do to, move back and forth. And I'm a very visual person. Obviously, that's why I like Sandtray, among others. But that seems to make a lot of sense to people as well. And it's a way to compartmentalize and understand what's happening to them. But then, you can do the same thing with like the miracle question. There's so many different ways to use that within the Sandtray. On one side, what is it like now? And if you were to wake up 5 years from now, what would it look like on the other side of the tray? And then what has to happen in between to get there? So, there's so many wonderful ways, to use Sandtray. Yeah. So.
Yeah, one of the things I think I like the most about your book is that you talk about the therapeutic process. It's not only about what you're doing, but it's just about being with the client. So two terms that you mentioned there is POT, which is not the pot that we're used to talking about in Colorado. It's the POTT, the person of the person of the therapist, and then the person of the Centroid, which is the post. So I'm wondering if you can talk a little bit, explain these two terms.
Yeah, so I come from a marriage and family background, and and a lot of the kind of traditional marriage and family graduate training, there's an emphasis on learning to monitor the person of the therapist while you're learning the professional theories and clinical skills. That they're not meant to be divorced, that at each step along the way you're maintaining awareness of that. And even as far as in my PhD program that was marriage and family as well, that we have been going through classes multiple semesters in a row where one semester is focused on your cultural background and how that interacts when issues related to culture come up in therapy, which is every second, or your connection to intergenerational awareness of gender and gender roles and gender beliefs and so on and so forth. And so we have this burden of in that kind of traditional background of saying, I can't learn anything about therapy that I haven't made room in myself as therapist to learn. And so I make the space and I learn the thing, and I make the space and I learn the thing. And then you're more equipped to be aware in moments in sessions when there's a part of you that's getting activated that's more about your story instead of the client's story. Your mirror neurons have been given some support in anticipation of that moment. And so that's the concept of the person of the therapist training program. And so we wanted to make sure in the book we set up Sandtray Therapist a way to say, if you want to monitor your person, your own right hemisphere responsibly, one of the best ways you can do this is to make sure you're using that tray yourself, that you're seeing it as a journal.
I like that in the book you shared some of your own personal experiences and with pictures, and I think that was chapter 4 or 5 that you share that, and I appreciate that because I think it gives the reader kind of look into a personal look into your own process. So again, we're not just describing content, but we're looking into a process.
You can give Linda credit for that. I would have not been courageous enough to volunteer that, but she encouraged that.
Thank you, Linda. Okay, so I guess I want to kind of ask you, Marshall, a little bit about the integration of Sandtray and EMDR. And EMDR, one of the most common mistakes that therapists do is to start reprocessing without enough preparation work. Is there something similar in Sandtray? Since Linda said that the Sand can be activating, how much time do you spend in preparation to the possibility of activation?
Mm-hmm. I would back up, actually wrote them to phase one and say, when you're history taking, part of your responsibility is you introduce miniatures and metaphor, and sand itself is to start watching the client's body's responses to the work, as well as how they're just giving you narrative. It's one of the reasons I like to start in the same way that Linda would train in the Adlerian world, was some kind of open-ended, non-directive prompting of just create a world, because you don't just need the factual history, you need to know how they access their history in this way and what can they tolerate, and just be a really good observer, and then make sure as you transition into that preparation phase, you are titrating it and putting any parameters in place that might support their best shot at staying regulated while starting to bring those EMDR phase 2 things into mind.
Yeah. Yeah. So Marshall, you're saying start off in phase 1 and knowing a little bit of your work about how the Sandtray can really just be used throughout the entire phases, right? Like throughout the entire process. I remember you saying one time that you even do like the timeline in the Sandtray. Super cool. Do the target sequence plan, do the history taking and conceptualization, all of it.
Yeah. Even like installation phase, body scan, it can all happen in the tray. And part of what I think is my responsibility is to let clients have as much freedom as absolutely possible. Just like we would in EMDR, we start off with the belief that free association is going to be beneficial to you unless you are giving me feedback that's helping me know I might need to offer a more restricted protocol so that you're staying more contained and just getting regulation practice while getting next to these struggles. You're doing the same thing in Sandtray. Like you're having to watch and then titrate in, which is a word from Ana Gomez, titrate and pendulate, about making sure you come back and forth to increasing contact with the things in the exact amount of time that they can handle. I think EMDR has often been falsely understood as a brief approach, and it's not brief, it's efficient. It takes the exact amount of time that someone needs it to take. And if someone comes in with more complex trauma or attachment wounding, which, we get into in the later parts of the book, then they deserve for that to go slower. They have the right to say, my nervous system hasn't been taught how to hold positive affect. And so I need some support in that. I can't assume that someone is returning to a level of safety that existed before the trauma, because if the attachment wounds have been profound, there was never a level of safety that entered into their mind and their body. So we're just going to have to really build into them feeling confident that moving towards woundedness is going to be worth it.
Yeah, I appreciate you saying that, because a lot of people have this false belief that EMDR is kind of like a quick fix therapy. They're just gonna, show up and start, processing in the first session. Then after 3 sessions, all, problems will be gone, which is not the case. And I'm wondering if you can talk more, Marshall, about that integration of EMDR and Sandtray from the lens of, attachment, and especially, trauma and attachment.
Yep, but you got to start a clock and don't let me go over 45 seconds because I'll get wound up.
I'll let you go a little longer.
I mean, there's a lovely surprise for me, and that I can acknowledge that one of my primary EMDR influences is in the room with us. Debbie Price was my consultant, and really helped me understand that this isn't a transactional model; it's a relational model. And because my prior exposure before training to EMDR caused me to want nothing to do with it, because I was shown it as something that you just do to someone. And it just felt robotic and scary to me. And then I got curious watching when I worked at this agency where Debbie was, there was just no denying that there was something different changing in her clients in the waiting room that many of us weren't seeing in the same way. And so she was able to kind of walk me into understanding that this is a holding modality. It's relationship first. It's client-centered, first. And then all the other things grew out of that. So it makes way for an attachment-sensitive understanding. You have to get to know, someone's patterns, and you have to make peace with the fact that everyone has all of these streams of insecure attachment in them. In fact, even the most securely attached adult, when you start processing trauma, you're likely to see some insecure attached patterns come forward, and be able to then adjust your spirit world, your inner self, and not just the techniques you're doing in order to meet them where they are. I think if we were really gifted at attachment assessment in phase 1, we would then be far more efficient with planning preparation. What resources does this stream of attachment deserve? What interweaves are going to be most likely to be needed when we get there? Understanding that a dismissive versus a preoccupied stream would probably need a little different kind of unsticking. And you just have a sense of connection and knowing where their defenders aren't going to pull you out of the process. There's a space of welcome because you've come to sense them as early as possible.
Yeah. Can I ask a question real quick, Marshall? What's a common, say, directive for the preparation through the lens of attachment? I know like Laura Parnell is the big favorite, but anything that comes to mind when you think about something that's based in attachment in the Sandtray that could help with prep?
One of the things that I've borrowed from in the attachment EMDR world is just being aware of safe state and not safe place only. That, first of all, someone needs to believe that it's okay to feel safe when they are safe and to feel unsafe when they are unsafe. And so one of my kind of leaning into preparation phase trays might be to ask them to do what Linda mentioned earlier and have two sides of the tray. Build one world where we know it's not safe, and we will talk about that. And then another world where it might be okay to be safe. And Ana Gomez has some techniques even that she's written about how to manage that. But if we let them know that we understand most of the time you've not felt safe, I think they don't feel tricked by us when we start trying to get them to go into resourcing, especially the more attachment wounded someone is. Everything feels like a relational setup, like, oh, someone's waiting to embarrass me, to trick me. My needs aren't safe here. So we can just use the tray to say, I want to witness all those parts. Those parts are welcome here.
Yeah. Oh, I love that. As you're saying that, like, I think about like, that's a common, people learn about safe place in EMDR basic training. And then they, stumble upon the situation where safe place doesn't work. It's contaminated. It just doesn't work. And then you think about like safe doesn't always feel safe. One thing that I learned about from Dr. Karen Freed in the Oaklander model, she talked about like have them create a safe place, but if it's unsafe and they say it's not safe, pick out one piece of that place that's safe, even if it's a tiny little part, and then that becomes the safe in the unsafe. I thought that was pretty cool. I wouldn't have thought of that on my own, I think.
Yeah, I want to ask a question that I ask every person I interview, and I guess I'll divide the question. So I usually ask the EMDR therapist, what makes EMDR therapists better? How can EMDR therapists get better at what they do? So I guess that would be a question for Marshall. And then Linda, maybe you can answer the same question just in terms of the Sandtray therapists. How do Sandtray therapists get better? And I know that you've written in the book, you wrote about consultation and having to do your own work. So I'm curious about, Marshall, your perspective on EMDR therapists, and Linda, your perspective on Sandtray therapists, how to really dig deeper.
Yeah, well, in addition, I think it's the same from EMDR. Go to consultation and stop believing that that's something that needs to end once you're certified. Like, it's not about a goal of reaching a piece of paper. It's a lifelong integration and having some other person helping you to maintain some objectivity and determination. Also, go to therapy, get some EMDR. Like, you really can't afford to not have contact occasionally or frequently with an EMDR therapist while you're doing EMDR. It's a necessary part of the job. The other thing that I feel really passionate about is not being surprised when you notice a shift in the person. The part of the person that makes the phone call that says, I want to come in for trauma therapy, is rarely the part of the person who shows up for the first session. And it's rarely the part of the person who goes home. That car ride that happens as they leave contact with you, and then they come back for, safe place as they move into processing. And you have to be able to not think of that diagnostically only. You have to be able to make sense of that on a human level. And Bonnie Badenoch always says, if you can't believe that all parts of someone are welcome, then you're probably not equipped to be doing trauma work. Because you're shutting down what's available. Like, who you're influencing what they think they can communicate to you. And so we got to do our own work to make sure we can really mean that.
Yeah, thank you.
And I would say a lot of that is very, very similar. I think it's becoming so familiar with the power of the sand and the Sandtray figures and what's created in it. And that happens in lots of ways at lots of different levels. I believe certainly having our own experience being a client using Sandtray with a more experienced Sandtray therapist, certainly that's incredibly effective. Many training programs and certification programs require a certain level or a certain number of Sandtray sessions in order to be certified. I do my own Sandtray work individually. Like, it's kind of funny for somebody who writes books, but I don't like to write in a journal. But I love doing my own Sandtrays. And so here in my home office, I have a modified set, and I'll do a tray and then when it needs to change, it changes. I do my own self-reflective work in the Sandtray. Certainly consultation groups are huge. And, in the United States, we're one of the few countries that believes once you have your license, you don't ever need supervision or consultation again. Other countries require it every month while you're practicing as a therapist. It's required to keep your license. So they can't, when I hang out with those folks, they just shake their heads like we must be a lot of really unhealthy people trying to do therapy with unhealthy people if we're not in our own consultation group. So, and I love doing consultation groups. I just started a new one this week, and just a chance to explore with other people, get other insights, other perspectives of what other professionals and colleagues see in the tray. Just that continual, the term I love from Marshall so much is curiosity, keeping up that curiosity of what I'm seeing in the tray and how that's impacted by what's going on in my personal life, and knowing what those boundaries are so they don't spill over into my understanding of my clients. And then I just enjoy doing sand trays. It's kind of like doing art therapy. I enjoy sketching. I enjoy doing sand trays as a way of self-expression and self-understanding. When I do supervision, I talk about at the end of the day for self-care, before you leave the office, do a tray of how you're feeling about just the whole entire clinical day as a way to express yourself and wrap up all of the clients and all of the energy that's been developed during the day. Or in the morning when you come back in, do a new tray about how you're feeling about the coming day and the clients you're going to be seeing. So that level of familiarity with the whole experience, I think, can only make us healthier, but also make us richer in our work with our clients.
Thank you, Linda. So, Jackie, I'm wondering if you have any other comments or questions before we open it up to questions from our live audience.
Just one thought. I love the book as a whole. It's almost like once I started reading it, and I got it last week, so I'm about 3/4 of the way through. But it's like one of those things you can't put down. But one thing that really called my interest is thinking about how sometimes the sand itself can be triggering. I'm a veteran myself. I spent time in the United States Army, and so I was EMDR trained just to work with veterans, and then it definitely went into my work with children and adolescents. But I think about how some people just don't like the sand. And I love that it's covered in this book that you can use alternative materials. I know Dr. Robert Jason Grant talks about too, using different materials in there for people that have some sensory issues. But I think that's really cool to bring it up, because sometimes I think we think sand tray, if they don't like sand, then we're going to skip on the sand tray and we're going to do something else. But sand tray is so powerful. If you don't have to skip on it, if you could still use it in another way. So I love, can you guys talk a little bit about the alternative materials? Suppose somebody was, say, in Afghanistan and they experienced a trauma in combat and sand or on the beach or anything, that they don't like the touch of the sand. I know I had an office mate that hated my sand tray. She was like, there's sand everywhere.
Here in Texas, a lot of people spend their childhood going to the coast with their families, and sometimes that's not been a pleasant experience, and they've been traumatized. It doesn't have to be in war in the Middle East, right? They could be traumatized on the coast of Texas at a family outing, and so trauma becomes an activator or a trigger. And I love that. And again, this goes way back historically. Many of the people developing their own method of working in sand tray didn't use sand. They marked out a piece of an area on a table or on the floor, and they never used sand. Yeah. So it was just using the figures, much less the sand alternative. They just didn't use it. And I know of many people that work with veterans who do the same thing. It doesn't have to be sand. It can be powerful figures using just the miniature figures without the sand. I think then you have to find a new way to manage and help regulate that a lot of us would use the sand to do. And a lot of clients self-regulate by all of a sudden just playing in the sand, right? As they just like children do, they just take care of themselves. But yeah, so a lot of the other alternatives are things like ground corn husks or ground corn cobs. It could be peas, it could be beans, it could be rice. Lots of different non-sand textures. Of course, then there's limits that you can't put water in it because, it becomes mushy. Another caveat here is that some cultures see that as a real misuse of food. And so it's not appropriate for some cultures to ask them to use beans or rice because that's seen as a real waste of food, and that's as counterproductive as just using sand with other people.
That's good to keep in mind culturally. I know, like right before COVID, I went to Canada to do an EMDR and play therapy training, and I bought all of these. I put them in my suitcase. It's like a dinner tray, and then I was trying to get Jurassic sand mailed up there. It was not happening. So I ended up buying lots of rice. Well, I had the person that lived there buy rice. The rice worked great. It was different, but it worked.
Yeah. Marshall, do you have anything to tag on to that?
I don't think so. But just maybe to remember that it might not be the feel of sand, that's activating. It could be even the color of sand. And so just knowing the client enough to say the texture is beneficial, but it's the color that reminds me of something, and you can switch that. Or if the fineness of the sand is a problem, there's a coarser availability is moving closer to rock. And so you have to get to know the nature of the overactivation without having to throw out the entire material.
Thank you. I want to end this conversation with one of my favorite quotes from the book. It's a very short quote, but one of the things I really liked that you said was that the most attachment and trauma in human sensitive therapy focuses on being rather than doing. So thank you for writing a wonderful book.
Thank you. Thank you for having this conversation. And thank you to Jackie, who's been an encourager and champion and promoter of the book for me and Linda.
Oh, yeah, it's much needed. I think you guys are changing the world with this for generations long after you're gone. This is
thank you. Yeah. Thanks.